Hello, my name is Diana Isaacs. I'm an endocrine clinical pharmacist at the Cleveland Clinic in Cleveland, Ohio. And for this month's Diabetes Sisters blog, I'd like to do a video blog on how medications are affected by exercise or physical activity. And so I want to go ahead and break it down based on the type of diabetes and the medications that a person might be taking. So starting off with type 2 diabetes, we know there's a number of medications that a person can be taking. And what we worry most about with physical activity is that a person might experience low glucose levels or hypoglycemia. The good news is that most drugs used to treat type 2 diabetes actually don't cause hypoglycemia directly. So this includes the big drug classes like metformin, GLP-1 receptor agonists, that's drugs like semaglutide or Ozempic, or dulaglutide, Trulicity, or tirzepatide, which is a dual GLP-GIP receptor agonist. Mounjaro is the brand name. So none of those drugs, when they're used by themselves, are expected to lower glucose too much. Also, other common drug classes are things like the SGLT2 inhibitors. Those are drugs like dapagliflozin, Farxiga, Invokana, canagliflozin, empagliflozin, Jardiance. So again, based on their mechanism, not expected to cause a low. So if you're taking any of those types of medications, at least you're not going to have to worry about your blood sugar going too low during the exercise. Now, where things get a little hairy is when you're taking any type of insulin, can cause a low blood sugar, or sulfonylureas. That's a drug class that causes the pancreas to secrete insulin. And that includes drugs like glipizide, glyburide, glimepiride, and then a less common drug class, which is also considered like a secretagogue that is causing the pancreas to release insulin, are nateglinide and repeglinide. So if you are on one of these types of drugs, then yes, it is possible that exercise could cause your blood sugar to go too low. Now, it'll depend on the type of exercise. So for example, something like aerobic exercise often causes someone to go lower, but it also depends on your fitness level. If you're someone that's pretty fit, you may be able to go for a walk or do some light exercise and not notice much of a change in your blood sugar. Versus if you're someone that maybe doesn't do as much regular physical activity, and even in some cases, people that do, just things like walking will lower their blood sugar quite a bit. Now, when it comes to intense activity, things like weightlifting, or even like sprinting, or just doing something that gets your heart rate up really, really fast, that is interesting. For some people, it will lower their blood sugars, but for many people, it will actually initially spike it up. And then later on, you may notice that it goes lower as the muscles are more sensitive. There's more insulin sensitivity in the body. So later on in the day, blood sugar goes lower. So all that to say is that we want to be so careful about what strategies can we do to reduce the chance of low blood sugars. So for those with type 2 diabetes that might be taking one of these medications, like taking a sulfonylurea, with those medications, it is really important to eat regularly, eat your routine meals, not go without skipping meals. And if you've been taking those regularly and you are starting to incorporate exercise, if your blood sugars are at your goal level, you're already meeting your targets, you may find that you either need to incorporate an additional snack before your activity, or what usually is better is if we can start looking at decreasing your doses so that you're not going low. It's similar for insulin as well. So with type 2 diabetes, a lot of people might be taking like a long-acting insulin, like a once a day background long-acting insulin. And generally, we try to keep this dose pretty steady. We don't really like when people are increasing the dose one day and decreasing it another. And the problem is that it lasts so long in the body that if you choose to decrease your dose today, depending on what type of the one that you're on, it could impact you 2 days later. And so it's not great to just be adjusting it every day. So in that case, if you're starting to do something brand new that drops you quickly, then yes, you may need to take in extra carbohydrates to prevent going low. But then what we want to do is we want to look at your numbers and see, hey, is there an opportunity here that we can actually decrease your insulin as you're incorporating more physical activity? And that often is great. We decrease those doses to make sure that you don't have any lows. And that also often can help facilitate some weight loss too. Now, mealtime insulin, that's where we have a little bit more flexibility to make some changes. And thinking about people with type 2 diabetes that may be taking mealtime insulin, or in the case of type 1 diabetes, with type 1, every person is going to be taking some form of insulin. And that can come through either injections, taking a long-acting with mealtime insulins, or using a pump, which is just going to be your rapid acting insulin, but you're going to have some running in the background. And then you're also going to be giving boluses when you're planning to eat. So when you do use mealtime insulin, there's a bunch of different ones available, and regular insulin is really the slowest acting and can predispose a person to more hypoglycemia than the others. So we try to use rapid acting insulins, and we even have some more ultra rapid insulins. The fastest insulin is actually Afrezza. It's inhaled insulin. So that's another consideration, because when you think about if that insulin's still working in the body, that's what can predispose you to having more lows. So some strategies that you can do if you're going to be doing an activity that tends to drop you is that if you're eating shortly before that activity, you can give a little bit less insulin for that meal and then go into the activity a little bit higher. And what's nice about this is then you're not having to eat an extra food right before the activity. For most people, we try to avoid having to take in extra food because the reality is that 70% of Americans live with overweight or obesity. So most people we don't want them to have to eat extra carbohydrates. If someone is not overweight and does not have obesity, then that is certainly a strategy that can work. But we try when possible to just decrease insulin doses. So that's something that can work well. Now you're probably wondering, well, how much should you decrease it? And unfortunately, I can't give you an exact answer because it really depends on your unique body. And so one strategy that can help a lot is to check, see what happens after your physical activity. Try to do routine things that are a certain set amount of time and see how much does your blood sugar drop during that activity. And that may help you determine how much you might need to decrease it. For some people, it could be taking half of their usual dose. And for others, it might just be a minor decrease, maybe 20%, for example, 10 or 20%. So that will matter a lot looking at that. Also, many people are now using insulin pumps, and specifically systems that we call hybrid closed loops that automate insulin delivery. And what's so great about these systems is that if you're predicted to go low, the background insulin will actually suspend. And so that can reduce your risk of lows. And another thing that you can do with these systems is you can temporarily set your target higher so it's less aggressive with the background insulin. So for example, if the usual target is 110, you can increase that target to 150. We do recommend that you implement this higher target at least an hour before the planned activity. Now, even with doing this, many people will tell you that it's not enough. Even though they set that higher target, even though they've got a pump that can suspend insulin, when they drop, they're dropping quickly, and that pump just can't. It's not fast enough. And it's really because of the action of insulin. Insulin it takes a while, it lasts a while in the body. So in these cases, there's a few additional strategies that can be done as well. Some people will actually completely suspend their pumps during exercise because they're just so sensitive, and that is an option. Usually you'd have to go out of whatever automatic mode and completely suspend it. Or if it's a tubed pump, you can actually just take your tubing off. Another strategy, again, would be to bolus a little bit less for the food beforehand, or to take in carbohydrates before. However, you have to be really careful with that strategy with one of these pumps, because if you do it too much before, let's say it's like an hour before the activity, what's going to happen is the pump is going to start increasing insulin delivery because you're going to start to rise. And so then you're going to go into the activity with all of this extra insulin running. So you have to be careful. If you're going to do that strategy, it's really got to be very close to the planned exercise, which of course can create problems because then you might go into the activity with a full stomach. So these are kind of all the things to think about. And for many people, it's going to be about learning how you uniquely respond and the type of activity. So going the other way, some people rise during exercise. They'll actually notice that their glucose is going up. Maybe it's more intense activity, or often lifting weights tends to raise a person. And so in those types of cases, it may just help to use kind of the usual type of settings that you're doing. If you rise a little bit during exercise, it's not the end of the world. We want to avoid going too high, going like above 300 or above 350. So that can work effectively, or combining some type of aerobic with that type of strength training to kind of help balance it out can help a lot. And for those using pumps, the pump will often be able to accommodate if it's an automated insulin delivery system. For the pumps that are not automated, we can do temporary basal rates to be able to accommodate that. But no matter what, we want to be cautious about what happens after exercise, because it's not just during the exercise. Also, after exercise, your body, your muscles are much more sensitive, and that can cause glucose to actually decrease again. So exercise, or even after exercise, we always want to have something on hand to treat a low blood sugar quickly. And generally, fast-acting carbohydrates is going to be the best thing to be able to use. And 15 grams of fast-acting carbohydrates is generally thought to raise the glucose about 50 points. And so during exercise, having something like Gatorade on hand can be really helpful, or glucose gel, and also having something nearby after the exercise. I mean, really, people with diabetes taking insulin should have something on hand all the time, but especially after exercise, having that nearby, understanding you might be more sensitive. Some people may set up different profiles in their pump where they have an exercise and post-exercise profile, because you can be so much more sensitive that you may not need the same amount of insulin for your meals afterwards. And even someone not on a pump, you may actually find that you need less insulin. And so, for example, if you usually give 10 units at your meals, you may find you only need 8 units. And so a lot of this is really, it's what we call pattern management. It's looking at the patterns and seeing what happens every time you exercise, and trying to learn how your body uniquely responds so that we can make a plan. And this is part of the art of diabetes, is that each two people don't respond exactly the same. And you may also find that you do something 2 days in a row, and unfortunately, you get different outcomes. And that's also because there's other things that come into play. I mean, how well you slept the night before, how much stress is going on in your life, the types of foods that you had beforehand, if you had higher fat or higher protein. So one of the things that can be really helpful is logging when you do your exercise. If you're wearing a continuous glucose monitor, those are so helpful to see your glucose patterns. And many of them in the apps or in the receiver or reader will allow you to place a comment about the type of exercise that you did and when it started, when it began. There's also other apps that you can use, like My Sugar and SugarMate, and apps that will even connect with like your smartwatch and will show, the activity minutes and the steps all in one kind of nice report. So those are fun things to do. And of course, you can always use paper and pen or pencil, I guess, as well. But the point is, if you can record some of these things and then bring it in to your healthcare team, your diabetes care and education specialist, and go through it together and try to come up with a good plan of, well, okay, should I eat something additional? Should I have half a banana before I exercise? Or how many carbs or how much insulin do I really need beforehand? And always have that backup, always have that hypoglycemia treatment. And also glucagon is important for every person taking insulin to have as well. We hope you'll never need it, but just having it just in case on you, in case you're trying to eat and you're just not able to raise the blood sugar as much as you would like. And then I also encourage you to work with your healthcare team about adjusting your insulin doses or other medications as needed, especially if you're taking insulin with other medications, really adjusting those, because if you're on a new exercise or physical activity journey, or you're losing weight, or even if you're not losing weight, you're gaining muscle and probably gaining insulin sensitivity, your doses will need to be adjusted. And so working with your team to make sure that happens. So lastly, I just want to say there's so many benefits to exercise. I mean, really so many, in terms of it really helping to promote, it can help to promote weight loss, but even if you lose no weight, it's really the effects on your mood, the effects on your muscle tone. And I think about this a lot, especially as we now have several drugs that we know are able to help with weight loss. So thinking our new drugs like Mounjaro, which is not FDA approved for weight loss, at least not yet, but we know, of course, usually causes a lot of weight loss. And then drugs like Ozempic and Wegovy, Saxenda, liraglutide, Trulicity, dulaglutide. So people are losing weight, fortunately, with these agents, but we want to be careful that we're not losing tons of muscle, that we're maintaining muscle mass. And so that's where the exercise can just be really, really important to maintain muscle mass. And also with aging, with healthy aging, we want to maintain that muscle mass, ideally lose fat, but not losing the muscle. And exercise can help us to maintain that. So that is a wrap. I hope that is helpful information. And thank you so much for tuning in.